I got on the scale after the first week and I had lost 5 pounds. And it was like, oh my gosh.
It's one of the biggest moments for weight loss in decades.
The weight loss trend taking over social media.
There are reports of an unexpected side effect, which includes Ozempic face.
The U.S. is seeing a rise in the popularity of weight loss drugs like Ozempic and Wegovy, but the high demand is also squeezing supplies for the diabetic patients.
Major weight loss and quick.
Baby, your girl don't like needles. Maybe if I didn't like food, I need to feel the way about food that I feel about needles who would be in this situation.
Splashy TikToks and diet testimonials have spread all across the internet and beyond.
I am down a total of 122 pounds.
Total weight loss is 17 pounds in 16 weeks.
But not everyone's on board.
How freaking lazy have we gotten?
A lot of people online, on social media, say that they are working out and eating healthy to lose weight. Newsflash, they're taking Ozempic.
It's all centering on this booming business of a class of drugs like Ozempic and Mounjaro, originally FDA approved to treat diabetes.
When I started on the Ozempic about 2 months into it, I seen my daily glucose drop dramatically.
They also both work in similar ways to reduce cravings, resulting in one particular effect, significant potential weight loss.
My Ozempic Trizone, I lowered my A1C, CV risk, and lost some weight.
Hollywood is raving about it. Comedian Rosie O'Donnell says she lost 10 pounds after going on Ozempic.
People are doing Ozempic parties here in LA where they all do an Ozempic. But I have diabetes too, and that's why I'm on it.
We fight for every single listing.
What are you drinking?
I'm having an Aperol Spritz.
$1 Million listing star Tracy Tudor spoke frankly about taking Mounjaro on the Sirius XM podcast. Jeff Lewis has issues.
Mounjaro. Both of you are on Mounjaro.
It's like trying to get like a piece of steak down. Like one sliver is
You got to
lot.
force yourself.
Literally, I was in the elevator. I'm like, "You're too skinny."
Yeah,
and I said to
know.
Shane, "Could you
Thank
imagine
you.
being
oh my God,
too
thanks
skinny?"
So
I've never in
much.
my life been too skinny.
Never in my life.
And comedian Chelsea Handler said on the Call Her Daddy podcast,
I went to lunch with like a girlfriend and she's like, I'm not really eating anything. I'm so nauseous. I'm on Ozempic. I was like, oh, I'm nauseous too. And then I'm like, but I'm not on Ozempic. And she's like, are you sure? And I'm like, well, what is it? I go, I'm on semaglutide. And she goes, that's what it is. Ozempic.
while these drugs have become the latest craze, there is a debate over access and affordability, over how they should be used and who should get to use them.
It's not about vanity, it's about treating a disease.
More than 40% of the U.S. population is obese, putting tens of millions of Americans at risk of heart disease, stroke, type 2 diabetes, and certain types of cancers, and even death.
Are these miracle drugs? We're hearing a lot about these drugs being miracle drugs. We in the field of obesity medicine think of them more as game changers.
Callie Svensson says the drugs have changed her life.
Hi, Callie, I'm ready for you.
Hey, how are you?
Hi, come on in.
Thank you.
She says she was struggling with obesity. Her doctor, Barry Weinstein, prescribed her Mounjaro.
It does sound like you're having really great benefits from the current dose that you're on. Right. So we should continue with this.
Nobody from the outside would know that I was constantly fighting this weight.
I love you. Hey, baby, how's school? Good.
Callie is raising 3 kids and a yard full of animals at a home in suburban New Jersey. It might look like she has it all, but just a year ago, she hit a low.
When were you your heaviest?
I was really struggling after my 3rd pregnancy to lose the rest of the baby weight. I was not able to do the things I loved anymore. Mommy was tired all the time.
And it's still really emotional to talk about even now.
It is, because you're drawn back to that dark place and you feel so hopeless.
She says for her, body image has been a lifelong struggle.
I would go to a pool party and I remember having to wear those big Speedo bathing suits and everybody else had the cute ones. And I didn't look like every other girl. And then the anorexia developed. And that took me into high school.
Going into your 20s, what did that look like?
The total control of food got away from me. I mean, I started slim fast diets when I was 8, and then I went into anorexia. So what does even a normal, healthy relationship look like with food? I've been battling something my whole life, not knowing how to properly control it.
By last summer, Callie says she had reached her breaking point.
I felt that food was controlling my life and I had no control. There was no off button and it was just going to get worse.
But after she started giving herself weekly shots of Mounjaro, she says the pounds started to peel off.
I never thought that at 40 I would feel better than I was at 20.
But the fact that these drugs are being used by people without obesity or type 2 diabetes may be contributing to a national shortage.
I was on one dose and the pharmacy reached out and said they couldn't get it anymore.
57-year-old Shane Anthony is an auto mechanic who was diagnosed with diabetes 2 years ago. Today, he says his health hangs in the balance.
I think a lot of these people don't understand that we need the drug to keep our bodies from falling apart. I'd done one refill, went to do my refill towards the end of the year and couldn't get it, and started making phone calls to the doctor and the pharmacy and had to go to something that was much, much older and really isn't working as effectively as the other was.
Shane and his wife, Jerry Lynn, herself a nurse, say the people who need the drug the most should get priority.
We need to have that. There's too many people that are diabetic in this country that depend on these drugs.
In a statement, Ozempic's manufacturer Novo Nordisk says we are currently experiencing intermittent supply disruptions on the Ozempic pen, which is anticipated through mid-March due to the combination of incredible demand coupled with overall global supply constraints. Eli Lilly, the maker of Mounjaro, says our priority is making sure Mounjaro is available to people with type 2 diabetes. Lilly does not promote or encourage the off-label use of any of our medicines. As of today, all doses of Mounjaro are available. Some pharmacies may experience an intermittent delay. Americans have been looking for quick ways to slim down since before color TV. From vintage newspaper ads to the age of infomercials.
7 pounds.
Advertising dietary supplements like Slim Fast Shakes. Or specialty diets like Atkins.
I've been living Atkins for years.
Fast forward to 2023, the Real Housewives of Miami are even taking weight loss shots on screen.
Help me.
No.
Wait, stop. What's in there?
It's a Fibronis shot to make.
While Ozempic and Mounjaro can be really effective for people who are obese, doctors generally don't recommend using them just to shed a few pounds. The long-term side effects aren't really clear yet. The Ozempic ads mention a few of the risks.
Serious side effects may include pancreatitis. Gallbladder problems may occur. Side effects like nausea, vomiting, and diarrhea may lead to dehydration, which may worsen kidney problems.
Does it disrupt someone's life?
The side effects associated with these medications are usually mild to moderate.
People like Callie say this is just a small price to pay.
I'm not going to say that any medication is perfect and nothing doesn't have its side effects, but you weigh, right? And for me, the benefits way outweighed some of the cons.
6 months after her first shot of Mounjaro, Callie is getting back on her horse.
And who's this fella?
This big guy is Navajo.
Okay. And how long have you had Navajo?
So Navajo I've had for about 5 years. Okay. That's Applejack. This is a really important hobby in my life. You know, I get my happiness from coming out here and being with the animals and working with them, and my kids love it. And if I couldn't do it, then who is going to? Because my husband sure can't do this.
Our thanks to Mona. And for more, check out Impact by Nightline on Hulu. The full episode, The Skinny Shot, drops this Thursday.
Hi, everyone. George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.